Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Pharmacy Medicine. Today we will discuss about Algor Mortis or cooling of body, which is the earliest sign of death. Algor Mortis is usually the first sign of death and it is followed by rigor mortis, which is a constriction of muscles. Sometimes out of death, the body temperature of cadaver falls and after some hours it tends to equal the temperature of its immediate environment. So this takes time. So usually the temperature of the body becomes normalized with the temperature of the environment and that which is the algor mortis. The fallout temperature of cadaver occurs due to cessation of energy of production and inactivity of heat regulating center after some time of the somatic death. Loss of body heat occurs by conduction, radiation, and evaporation when the body is in an atmospheric environment, and by conduction and convection method when the body is in water method. The time series death curve, if we plot it, the curve of cooling pattern is sigmoid, bi-expositional or inverted S-shaped in shape. So it will be inverted S shape. First few hours, the curve will be flat because it takes time for heat to dissipate from the thick skin. Later on, it falls immediately as the body temperature starts decaying, starts losing. Then after a few hours, it becomes flat line. As the bacteria growth in the body starts developing, the bacteria starts developing as bacteria develops, the heat is generated and it is slightly more than the atmospheric temperature. For the purpose of estimation of time since after death, the measurement of the inner core temperature is more important and reliable than the outer temperature. So measuring the body temperature, rectum, different part of the body like rectum, which is said to consider above NS is used. External aortic meatus, subhepatic, that is inferior surface of liver, nostrils up to cribriform plate, intercerebral through the orbit are the parts which are usually used for measurements. Usually, clinical thermometer, not clinical thermometer, which is 10 to 12 inches long, with graduation ranging from 0 to 50 degrees is required. The average rate of fall of the body temperature is about 0.4 to 0.7 degrees centigrade per hour, and the body attains environmental temperature at 16 to 20 hours after death, after which bacterial decomposition starts and it slightly remains above the environmental temperature. A rough estimate of time since death can be obtained from using the formula, which is normal rectal temperature minus measured rectal temperature divided by rate of fall of temperature per hour. So if we calculate normal rectal temperature, which is about 36 to 27 degrees centigrade, minus the measured rectal temperature divided by the rate of fall per hour, will give the time since death in approximate hours. Different factors affects the algor mortis. First is environmental factors, which is a major factor as it depends. Body temperature, fall of body temperature depends on the environmental factors, mainly if the environmental temperature is hot, then the temperature will fall slowly. If the temperature is lower, then the fall of temperature will be faster, like that. Air movement. If there is more air movement, the air will carry the heat and the body will cool rapidly. Humidity. Cooling is more rapid in humid rather than the dry atmosphere since moist air is better conductor of heat. Then media of disposal. Cooling is earliest in water, late in buried bodies. The ratio of rate of fall in different media includes water to air to solid is 4:2:1, which means that rate rate of fall of temperature is more in water, moderate in air, and minimum in buried bodies. So if the body is in the water, it fall in temperature is more compared to in air compared to in buried body. Built of cadaver. If the body is obese, the fall temperature is less compared to if the body is lean. Similarly, in female bodies, it is less. Age and sex. Rate of loss of heat is more in children and elderly compared to adults because of size and weight. Clothing and covering of the body. So if the body is covered, the rate of fall temperature is more, is less. And if the body is exposed to temperature, means the body is naked or one of the piece of cloth is removed, then the body temperature will lose rapidly. Position and posture of the body. So body, if the position is flat, if the person is lying flatly in supine position, the fall will be more. If the person is curled up, then the rate of fall will be decreased less. Mode of death. If the whether the person has died naturally or unnaturally also depends, affects the rate of cooling. If the person had done some rigorously had a assault, if the person has a assault and he was in a fight, then the body temperature is more at the time of death, then it will fall, or rate of fall will be less in that cases. Now coming to postmortem caloricity, this is a one exception condition to Algor Mortis. In this condition, instead of cooling, the temperature of body remains high for initial 2 hours or so. This is due to different reasons. One of the reasons is postmortem glycogenolysis, in which occurs in all dead bodies which starts from after death. It is produced about 140 calories. So this is one of the condition where because of the glycogen decay, there is the body temperature increases. In certain cause of death, body temperature increases. Like in case of infectious diseases, septicemia or bacteremia, heat is produced by action of infective organisms. If death is preceded by severe convulsions, as in tetanus or strychnine, it causes increase in body temperature. In case of death due to heat stroke or pointer hemorrhages, the heat regulation system is very disturbed before death, and in this also there is increase in body temperature after death. High environment temperatures in tropical countries, when the environment temperature is higher than the body temperature, that dead body may absorb some heat and the body may not lose the heat. Medical importance of Algor Mortis: it is a sure sign of the death. It helps the estimation of time since death using the formula, and rapid cooling of dead body delays the process of rigor mortis and decomposition. So cooling of body delays the process of rigor mortis. So if the body is frozen, then there is no rigor mortis doesn't occur, and decomposition also is delayed in those cases. These are my references. Thank you.